Now that I'm here at the end of the entry-level OTD program, I look back at the experience and I think the design of everything that we did was very, very intentional. We had evidence informing what we did, theory and occupation at the base of everything that we learned. And we had a good combination between clinical experiences informing what we were learning in the classroom and vice versa, so we could always connect back what we were doing.
I think there's a lot of advantages to the hybrid model that BU uses that sort of combines clinical work and online learning and also classroom learning. One big benefit for me was the flexibility I had during summertime, which is when our coursework was online. So I could work part-time, I could pursue other opportunities, volunteer opportunities, and I also didn't need to be on campus in Boston.
Occupational therapists can work in so many different settings, but regardless of the setting, we have to know how to advocate for our unique contribution and role. So I feel like we've really been given those skills within this program to be able to articulate why we're doing what we're doing and why it's important for our clients to receive our services.
When you're out in the field, you're really grateful to have that foundation, to have the knowledge and the clinical reasoning that you develop through that deep study of theories and evidence. And it really does make a difference when you're out in the field practicing with real patients.
Leadership's a really important value to the faculty in this program, and I feel that we're trained to be future leaders within the occupational therapy field through coursework, but also through very close mentorship with faculty. So examples of that mentorship might be doing research and then flying out nationally to present that research at a conference and communicating it with the wider OT field.
Over the last 3 years of my doctoral education, in addition to all the clinical skills and knowledge I've gained, I think the biggest way I've changed is I've just become a more confident and competent practitioner. I feel like I could go into any practice setting and succeed now.
For me, the most meaningful experience that I've had across my 3 years with Boston University is building wonderful relationships with my peers and the faculty that are here within the department. I got to try my hand in research and a graduate assistantship. And so I just feel that the diversity of things I got to be involved in was very valuable.
I am hoping that I'll be able to work in a public school system or with some sort of underserved population. That would be my ultimate goal. I think my dream job would definitely have to do with adaptive recreation and integrating sort of therapeutic outcomes into an outdoor education environment.
Upon completing this program, I'll be studying for and sitting for my licensing exam and then applying for jobs within the school district because that's an interest that I identified on my clinical experiences within the program. Long term, I hope that I'll eventually enter academia and teach because I've been inspired by so many great faculty mentors here within the department.
It's an academically rigorous program. There's a lot of work. It was 3 years of my life that I devoted to it, so it feels, very fulfilling to be done.
I made the right choice in deciding to come to Boston University for my OT education because I got so many great opportunities for training, great relationships with my peers and faculty members, and I'm confident that I can now be a great occupational therapist because of the education that I got here.